It's good to have you here with us. Today I'm with Dr. Mwale. Dr. Mwale, say hi to everybody out there.
Hi everyone, hope you're doing all right.
Thank you very much, Dr. Mwale. We've been talking about hypertension in the last few weeks, why it's important that you take your drugs, the complications you might have, a stroke, a CVA, even a heart attack. I think just a few weeks ago we were talking about what a TIA is and how you can know when somebody is having a TIA. But there's another age group of women that we haven't really talked about, and these are pregnant women. Pregnant women are also at risk of having hypertension, but theirs is a completely different kind of battle, and that is why we have Dr. Mwale here with us today. Dr. Mwale, kindly shed more light. Why would a pregnant woman suddenly have a high blood pressure?
For starters, I would love to put across a message to the people that will be watching this video to say that pregnancy in itself is a condition that predisposes one to develop hypertension. Even if they've never had hypertension before, with every pregnancy that they have, there is a high chance, there's a high likelihood that a woman would develop hypertension. And this solely comes because of some of the changes that take place during pregnancy, and that would actually predispose a woman to developing hypertension.
Okay. That's very good. How would a woman know if she's having hypertension? And when is it dangerous? Does it apply for a woman who's in her first trimester, second trimester, third trimester? What would be the telltale signs? Because as we know, in most cases of hypertension, it simply doesn't have any symptoms at all.
So it usually gets to be a bit more prominent after, let me say in layman's term, after 4 months of, after 5 months of pregnancy. That's about 20 weeks or so. So that's when we really get to pick up the features of hypertension that results from pregnancy for the very first time. So I would have to clarify to say there are certain women, of course, that would be hypertensive even before they get pregnant. But then there are others that develop hypertension for the very first time, usually after about 5 months of pregnancy. And some of the giveaway signs would be that someone would be complaining of headache that keeps coming and getting worse. Someone would start developing swelling of the body. Now, swelling, especially of the legs, is a common thing in pregnancy, but there are times that it gets to be generalized. It gets to be like the entire body is involved. That is also another giveaway. Other features that would come is a woman would start complaining of blurred vision. They would start complaining of pain in the abdomen. And that pain is a bit particular in that it's usually on the upper side on the right. So it's a bit particular like that. And then, like I said, the headache, that usually come around near the eyes and also slightly by the sides. So those are some of the giveaway features. But of course, we understand that hypertension is a condition that affects almost every system in the body. So besides some of those that would obviously see, of course, with further investigation and assessment, we would be able to pick up others.
Okay. Just to take you back a bit, Dr. Mwale, you mentioned blurred vision. What exactly is blurred vision? Or can we say something like hazy vision? Or
exactly.
If a woman has problems seeing, generally anything giving a woman difficulties seeing. Right?
Exactly. So it's just, it's like the way your vision was before has pretty much changed. Yeah. So it has become a bit hazy, a bit cloudy. You have pain in the eyes when you are looking at something.
Good. You also mentioned that these women tend to have epigastric pain. This is pain that, if I'm not mistaken, is pain right below the sternum, right? Just around about here.
Yes, and it may be slightly on the right upper side of the abdomen.
Okay, so on the right side of the abdomen by the top, that works as well. Well, so those are the things that you can get. And usually, if you start having those symptoms when you're pregnant, it means that it's quite advanced. Exactly. Whatever is causing the hypertension, it's in an advanced stage. It's usually called preeclampsia in pregnancy. You can look it up online. There's a lot of information that you're going to find. So, what would be the take-home message for a pregnant woman who you wouldn't want them to come in the state you have described?
All right, so the take-home message to a pregnant woman, first things first, the moment you realize that you are pregnant, visit your antenatal, start your antenatal care. Why? Because during antenatal, it is routine that your attending healthcare provider will measure your BP, and every time they notice, there will be time when your BP will be high, but you'll be asymptomatic, you won't feel anything. So if you go to your antenatal and your BP is peaked and it's noted to be quite raised, they would quickly either send you to a bigger hospital or they would start treatment. That is the first take-home message I want to put across. The other one is, in as much as you are pregnant and you've been attending your antenatal, the moment you start having some of the features that we've talked about, even if your date of antenatal visit has not yet arrived, be at liberty to go to the clinic and be checked out. Because if you just stay home and you're waiting for that date, you may never know. Your BP may be too raised, and then there would be a whole lot of complications that would come in, both on you and the unborn baby. So the moment you feel unwell, even if it is not yet time to go back for your antenatal checkup, it is always advisable to quickly go to the nearest health center and be checked.
Thank you very much. So that's a very important point. Even before your scheduled date arrives, if you feel funny, if you feel different, go to the hospital, because hypertension in pregnancy is associated with a lot of complications. Bad complications, like Dr. Male has said, both to the mother and baby. And one of which is what we were discussing last time. Prematurity, yes, can be a complication. How can that happen, Dr. Male? How does the hypertension lead to prematurity?
So if hypertension, if the BP continues to be high, we are worried that we may end up losing the mother or the baby. How we lose the mother is there are certain times that another complication like eclampsia would come in, she starts fitting, and that affects the brain. But on the part of the baby, there's usually an effect that comes into the blood circulation that goes to the baby. So we may actually end up losing the baby. So the way prematurity will come in is that if your BP continues to be high, we may end up actually delivering you before time. So you find it's a couple of months, not yet 9 months, but then we'll have to deliver you so that we save you and we try and save the baby as well.
Thank you very much, Dr. Male. I think our time is up. So to everybody that is out there, please feel free to share this video to everybody that you think would benefit from it. If you're pregnant, enjoy your pregnancy. Thank you very much and have a nice day. Dr. Male?
It's always a pleasure. God bless you all.